all of you here, and thanks for attending the 2010 State and National Legislative Summit. I am Carmen Collado, President of the Association of Hispanic Mental Health Professionals. I am honored to have been invited to co-chair this meeting because the topic of Hispanic mental health disparity has been a top public policy priority for me since I first chose to be a mental health professional. It is an issue that has galvanized our community and brought many of us together to work on this issue. We have success, but the basic problem still eludes us. There are not enough Hispanic health professionals to serve the needs of Hispanic communities. The impact recent public policy shift will have on the disparity is an important discussion we'll be having today. I am pleased to see so many of our most important Hispanic leaders from the private and non-profit health sector among we partners in government. We have with us our top Latino elected official in the Assembly, Assembly Member Peter Rivera.
Muchas gracias. Thank you for those very kind words. And congratulations to all of you. I wish I could stay here longer because I think this is such an important event. I really think that whenever there is a dialogue between legislators and policymakers, I think it adds to a richer government, to a richer community, and so on. And as always, when I come to these things, I get bombarded, gladly so, by the way, with requests, with issues, with ideas. And I truly enjoy coming to these things because some of the best ideas come from a dialogue between your elected officials and you. As an aside, and just as important, is the fact that we have a new government in the state of New York. Not a new governor, but a new government. And as part of that new government, one of the things that I have always fought for, and I have always tried to assure, is that the Latino community continues to be represented, continues to grow in representation in the state of New York, and continues to ask for and receive its fair share. And I was fortunate enough to be placed on the transition team. And if you look at the transition team, one of the complaints you're going to have on the transition team is that there are 6 transition teams. The transition team that I sit on is economics and labor. And it's a strange combination of you have economic development and labor. There's a health transition team. There is a local government transition team, and on and on and on. But there are 6 transition teams. We have the ability to impact on the other transition teams. And one of our mandates is to make recommendations to the next governor as to who should be the individuals who should be considered for high positions on his next administration. Now, our focus and our goal is not for the entire department, but for the top 2 or 3 slots in each department. And it's truly amazing to be, I've sat on other transition teams, so I think the word has to get out to our community. Now, let me give you the bad news. The window for us to receive the information, act on the information, review the information, and make recommendations is a very short window. The next governor would like to have all the information at his disposal before December the 25th. And if you work backwards, you're really talking about a month. 6 weeks to be exact, but truly I want to talk about a month. We have 10 days between this past Tuesday, which was our first meeting, and 10 days hence from that date, to gather the initial resumes. Now, the initial resumes are not going to be the final resumes, but we have 10 days to gather the initial resumes, to submit these resumes. The resumes come to us, and we submit the resumes to the other members of the committee. And then we are going to try and interview as many of the people as we possibly can And then we're going to try and make as many recommendations as we possibly can. Now, when you look at economic development, many of you are saying, oh, that's Empire, if you know government, that's Empire State Development Corporation, ESDC. No, it's much bigger than that. Our task is the following agencies when you look at economic development. We have such a diverse area as the Workers' Comp Board, Taxation and Finance, New York Lottery, tourism, OTB, and so on and so on and so on, including some agencies that you would not immediately identify as necessarily finance agencies. So it's the breadth, and it's also the authorities like the Dormitory Authority, the Empire State Development Agency, and a whole bunch of other, Jacob Javits Center, Battery Park City. So, as you know, I can sit here and spend an hour explaining to you what the mandate is. I see a good friend of mine who I will not introduce because somebody else has been given the tremendous honor of introducing my colleague, and I'm sure that he has some great things to say. So, I welcome your input. I'm going out of town tomorrow, but I will be back next week. And if you have any ideas, please forward them to me. My telephone number is 718-931-2620. Thank you again, and have a good day. And Felix, have a good day.
Well, we have just been joined by the chair of the Puerto Rican Latino Task Force and also the chair of the Mental Health Committee, Assembly Member Felix Ortiz.
That was too quick. Now I know why Peter left. Now I know why Peter left so fast. Let me just really thank Carmen and the group that invited me to be here with you all, George and others. This is a great forum. It is sad that we elected officials only come for a moment and had to leave rather than stay and listen to what everybody else had to say. But I didn't plan to leave too early because I need to be in D.C. tomorrow morning. So I had to. I have another forum that I've been talking almost about the similar stuff that you guys are talking about here tonight. Let me just very quick, just to set the tone a little bit. As you know, when we talk about health disparity among Hispanics and in our community, the first thing that comes to my mind is, Felix Ortiz, what kind of district do you represent? And when I look inside myself and I look inside the district that I represent, now I know why we have such thing as a health care disparity. Because reality is that healthcare disparity comes as a result of socioeconomic, comes as a result of poverty, comes as a result about quality to access to healthcare, and comes as a result of so many other variables where individuals like ourselves sometimes don't have access to, and also not only about the lack of access, but also about sometimes about the kind of thing that we sometimes are in denial because we don't want to go to the doctor. We don't want to go to see a physician because of whatever reason. And if it's a male physician, I'm a female, so I don't want to see that guy. If it's a male and it's a female, depending what the circumstances are, I probably would not see him either. So the reality of life is that we do have a problem when it's come down to our own health. We sometimes go to our health to take care of ourselves when sometimes probably say to us, you're suffering from whatever, or somebody has been identified, so it's when we jump. Well, we all know this. We all know that we have a serious problem among the Hispanic community on diabetes. We as you probably know, some of you have probably have seen me in the last 2 days fighting another issue, but I'm not drunk today. I'm good. But the bottom line is this. Bottom line is when we talk about healthy lifestyle, when we talk about nutrition, when we talk about diabetes, when we talk about our childhood obesity, and when we're trying to talk about bringing the science into the politics to develop good public policy, sometimes we run away from it. And sometimes we run away from it because, I understand in the community that I represent that sometimes my people has to work 2 and 3 jobs. So I understand that sometimes my grandmother is the one who had to take care of my kids. And sometimes I understand that my grandfather, depending who he is, will also take care of my child. So in reality, we are in a very economic depression, if you will, to put it in a better word. We are really in a lot of pressure among ourselves to take care of our children and give our children what my mother used to give me, good nutrition, because she had the time to stay home. She didn't work. Well, let me take it back. She did work at home. She worked more than my father. I always say that, but my father never admitted that. But she worked so hard at home to take care of 6 siblings. She worked very hard to take care of 6 siblings, to give us good nutrition, as well as to make sure that every single one of us got our homework done before my father came home with the, you know what. But the bottom line is health disparity is a very, very big issue among ourselves. And I will say this to you too, that unless every single one of us sitting in this room begin to contribute positively to be part of the decision-making process in politics and in government. As you know, the governor-elect has put some transition team in place together. And I repeat myself again, he has put some transition team together. When he came to Puerto Rico, he said to us, we thank the Hispanic community because they voted 80% to get me elected. And my Italian community only voted 50%. That was his quote words, okay? Well, I will challenge the new governor, and I've been very public and critical on this, that if we was 80% who elect him to office, I will assume that the transition team should reflect 80% of the Hispanic community. And we should not let him out of the hook. And we should not be afraid to speak out. We should not be afraid to stand up and demand what belongs to us. So as a Hispanic community, we can do well under the new administration, or we can fail under the new administration. It's going to depend on how we proceed to demand what belongs to us now, by him recognizing that 80% of the Hispanic community did vote for him, that 50% of the Italian community voted for him. So that's a big discrepancy. You're talking about 30%. So why the transition team still does not represent the Hispanic community on the 80%? And we cannot be afraid. And if we have politicians that are afraid to speak out, they should not deserve to be in office. And it's too late to get it out of office because they already got reelected. But I hope that you can take note, because we can no longer continue. We can no longer continue to get people elected to office on our backbone, and when it's time for the distribution and allocation, we're still running behind schedule. And we are not sitting in the rooms. We are not sitting on the table. And when you open the menu, what we see is ourselves on the menu, not on the table, to make decisions. And I don't want to see my name on the menu in any way. I want to see myself on the table, making decision on public policy that is going to impact our community in order for our community to be better off in the 5, 10, 15, 20 years from now. Last but not least, everybody has a lot of predictions. Everybody looks for predictions. But the predictions are that our community, the Hispanic community, in the year 2020, not too far from now, is going to suffer in bigger numbers. 1 in every 4 persons suffer from diabetes. What that means is that 1 in every 4 persons will be what? Not productive. Will be probably losing a lot of time at work. So will be taking care of themselves a little longer. So therefore, it's our responsibility to be part of the process by being on the table. So I encourage every single one of you who probably know somebody in the transition team and somebody very near to you that begin to email to our governor-elect and the transition team to let them know that it's very important, that is above and beyond what you have in the transition team, are people and professionals also outside the transition team that they are caring, they care about health care, they care about health disparity, and we want to be part of the process by being on the table, not on the menu. Thank you. May God bless you.
Thank you, Assemblyman Ortiz. And now it's my great pleasure to introduce to you the chair of this meeting, who has gone above and beyond to coordinate this roundtable, George Seppenfeld. With over 20 years of experience in marketing, public affairs, strategic partnership, and community government relations, Mr. Seppenfeld has been a leading diversity advocate with the healthcare and small business community. Mr. Seppenfeld has served on numerous boards of directors where his role has focused on marketing, fundraising, membership, development, and strategic partnership. His accomplishments are many, and in the interest of time, I have chosen few I would like to highlight. In 1998, he founded the Association of Hispanic Healthcare Executive East Coast Chapter, which reaches over 3,000 individuals and affiliate organizations in 14 states. He currently serves as co-chair of the Business and Consumer Issues Committee on Community Board 7. He served on the coordinating committee of the New York City Collaborative for Fairness of Equity in Philanthropy, which is advocating for greater participation of minority-led non-for-profit in foundation giving. Finally, Hispanic Executive Magazine, in the most recent issue, profiled his work in developing the Association of Hispanic Healthcare Executive and the National Hispanic Chambers of Commerce on Health. The conclusion remarks state that one thing is for certain: if Mr. Seppenfeld and his colleagues continue to advocate for Latinos in the field, the healthcare industry will more closely mirror the population it serves. Mr. Seppenfeld?
Well, I want to welcome everyone tonight. It's great to see both new acquaintances and recent. I'm trying to stay away from the word old. I know these negative connotations, so I'm not going to use that word old, but a lot of friends here and hopefully new friends and new partners. And certainly want to welcome you to what is really the second roundtable, legislative roundtable we had. We had our first one about 6 years ago, but we decided to formalize the organization as a roundtable. And from the hours of 5 to 6 this evening, we had all the presidents that you see here before you at a special meeting to discuss some strategy. And it's kind of interesting because we heard some comments from the assemblymen, and it's really echoed what we thought we had to do. We have to work as an organization, as a team, and look at some of these political appointments, particularly in light of the new administration in New York State, and certainly nationally, and hopefully be able to use this as a model for future roundtables throughout the country. So I want to, number one, thank all the presidents of the organizations that have come a pretty long distance to join us tonight. It's an honor to have you all here. You're here because you're all leaders, and you spend a lot of time outside of your normal activities working on behalf of the community. I also want to acknowledge certainly these wonderful facilities that we have here tonight, courtesy of TIAA-CREF and Charlotte Bach, who's leading the Hispanic initiative for the organization. I'm sure you're going to say, wow, couldn't I have this in my office? And I guess the answer is yes, if you have the money. But it's certainly great to be here, and thank you, Charlotte, for this opportunity. Unfortunately, tonight, the representative from Aetna is unable to join us, but I certainly want to thank Aetna. They've been a firm supporter of both of our organizations for a very long time. I want to thank our regional partners, many of whom are present here tonight, and I really have to do a special holler out to, I don't know where she is, she's probably hiding someplace, but Miliona Frietti. Millie's a new board member. Millie, we get a little award. Millie's a new board member. She's chair of the development committee, and she's really my right arm. And she's kind of one of the people behind the scenes that you don't see, but does all the editing, does a lot of the transaction with our vendors, and I really appreciate all the work that she's done. Tonight I wanted to address a few issues, and one of them I'm going to just address briefly because all the representatives of Greater New York Hospital Association aren't here tonight. So yet, they're on their way. I know that Lloyd Bishop, the Vice President of Government Relations, is back there. I don't know why you're hiding, Lloyd, because you're usually up here in the front. But Lloyd, thank you. But I certainly want to recognize the members of the Roundtable. I think this is a very strategic move on our part, and it's going to be a entity that's going to be around on an ongoing basis. And it's not a roundtable that's going to be every 6 years. So we're going to work diligently on an ongoing basis. Our collaboration with Greater New York Hospital Association is really looking at 4 areas. I'm going to outline some of the 4 areas, and later on we'll make a special announcement when the other members come in. The areas are going to be looking at a council of future Hispanic healthcare leaders, whereby we're promoting so that we can promote the work of AHHE within member institutions of Greater New York. I think one of the issues that we have is that even in the world of the internet, there are still individuals out there that don't know we exist. So we're going to hopefully, with Greater New York, expand our network and expand what we do, our mission and our vision, to their member institutions and Latino members, as well as non-Latino members in their organizations. We're going to start to develop a quarterly lecture series for those individuals that are members of our Managers Council. Now, our Managers Council is an entity that was formed about 2 years ago. Now, we realized that there were few Latinos in senior C-suite positions within healthcare institutions, and certainly not just in New York, but throughout the country. I had the honor a few years ago of serving as a member of the board of the Institute for Diversity in Health Management, which was the diversity division within the American Hospital Association. And we certainly saw that the number of Latinos in leadership positions and policymaking positions were not there. So we said, all right, what do? We just can't let that happen. We have to start developing the pipeline. And as a result of that, we started to look at different mechanisms. And the mechanism that we selected was to establish a Managers Council, and at least to start to nurture that initial group. I want to recognize, and actually I'm going to ask them both to come up to the front here to acknowledge them. So the 2 co-chairs of our Managers Council are Andy Nieto from New York Presbyterian. Andy, please come up here in the front. And Clara Irizarry from Memorial Sloan Kettering. Clara? Now, there is a reason why I'm also doing this, because I'm going to put them on the spot, right? Because I want you to see who the face of the next generation and who the face of the next mentoring group is. So, Andy, why don't you just say a word about the Managers Council and how important that is to grow the org?
George is always good at putting people on the spot, but the Managers Council has, for the last couple of years now, targeted middle management level individuals within the different organizations throughout New York City, and hopefully developing a network of resources for them to be able to, move up in their careers, and providing them with opportunities to meet others of Latino executives within the hospital setting. So we've had several forums where we've brought in some guest speakers to come in and speak to the different managers. We've had some pretty good turnout at these events. We've also recognized at the annual meeting the Middle Manager of the Year award through AHHE. So it's a work in progress. So I think it's having some very good success, and I hope that we can help the future leaders of healthcare promote those. Thank you.
One of the other areas that will be involved with the collaboration with Greater New York, Sam, you have a seat over here in front here, is looking at how we address the healthcare workforce. And one of the areas that we will be working with Greater New York is looking at how we find funding to support mentoring programs, particularly looking at high school seniors that are looking at different careers in college. A lot of times if you're a senior in high school, you may have a background in science or mathematics, but you're not quite sure what area. You may not want to be necessarily a physician, or you may not want to necessarily be a nurse, but we have to let them know that there are other options out there. So this mentoring program that we're going to be working with Greater New York will help to identify how we do some workforce development in areas not only in medicine, in nursing, in health administration, but certainly other areas. And lastly, we want to start talking about, and we've actually done some work in the area of supplier diversity. Mary, I'm not going to let you sneak in over here. And the eagle eye over here.
I was working.
As you know, Mary is with Greater New York Hospital Association. So one of the areas that we want to look at, and the chair of our National Hispanic Chamber of Commerce on Health will discuss it further, is how we can work with the hospital industry, the managed care industry, and the pharmaceutical industry to look at supplier diversity opportunities for minority and women-owned businesses. And particularly in this economic climate, it's important to look at different industries that really haven't been too active in that area. And I know it's difficult because a lot of corporations are cutting down on the number of suppliers that they have. But we just have to find a way. We have to, I think once we start developing the relationships, that's when the actual business will flow. So we're looking forward to developing that area. What I'd like to do, and we're gonna talk about a special opportunity from Greater New York a little later, but I want to start and give our panelists an opportunity to make some comments about issues that are important to their constituents. And I'm going to start off with just going down the list here. I just want to make sure that, know if we have Dr. Lauro Medrano in the audience. Doctor, would you come up here, please? And there's a spot over here for you. Dr. Medrano is representing the Hispanic Dental Association, so Dr. Yolanda Bonta wasn't able to join us, and Doctor was kind enough to be here. Thank you very much. So what we're going to do now is I'm going to start off with Miriam Zavala. Miriam is chair of our policy committee and a board member and an expert in health disparities. And she's going to give us a little bit of a background from the perspective of AHHE on an issue of importance to our constituency.
Thank you, George. The impact of Patient Protection Affordability Care Act on the Hispanic population is significant, as it contributes to addressing Hispanic American health care needs, such as immediate access to health coverage to the 32 million uninsured and underinsured. And basically, who are these uninsured and underinsured? They are working families. 80% of the uninsured are United States citizens. Of those 32 million that are coming on board are 9 million Hispanics. Small businesses, which is where most of our Hispanics are employed, receive their health coverage, about 43% of Hispanics. The others do not because of their area they work. This act will also give access to primary care because 50% of Hispanics do not have a regular doctor. There's also disease prevention, enhancing the quality of healthcare services by holding the providers accountable through those who are federally funded programs must collect and report data. And the expansion of healthcare workforce and increasing diversity by providing scholarships, nursing loans, training to healthcare employees, because only 5% of all the healthcare professionals are Hispanics, such as doctors, nurses, dentists, etc. AHHE supports programs and policy to increase the presence of Hispanics in healthcare executive positions because healthcare executives are the ones who decide what type of healthcare services are going to be rendered to the community and how those services will be rendered to the communities. Now, the impact of the 2010 election on PPACA, I'm calling it PPACA for short. As we know, the Republicans and the Democrats have different ideologies, which results in legislation that at times are opposite of the spectrum. Now, I must stress we must be aware of our new congressional leaders that are coming on board in January because they will impact PPACA. The Hill experienced a political tsunami. The House, by the Republican, gained 61 seats, making them the majority, while the Democrat Party will lead the Senate and the White House. The Republicans are saying this is nothing new. They're going to repeal PPACA or not fund the Patient Protection Affordability Care Act. If this happened with the repeal, there may be a backlash to them because, according to Kaiser's tracking poll, a lot of us United States citizens favor some of the provisions. The bill is not perfect, but provisions such as closing up the Medicare donut hole, preventing the discrimination of those with pre-existing health conditions are very dear to us, all Americans. And that's about 72%. That's big. If they don't fund the Patient Protection Affordability Act, what's going to happen is it's going to create a stalemate, a slowdown, or they may use this issue as a powerful dividing wedge in the 2012 elections. Health insurance companies and other stakeholders may find this environment very unstable. If the House and the Senate do not dialogue, this is going to lead to a very toxic political climate. AHHE is setting up this legislative summit because we are poised to be a resource to our elected officials in trying to prevent the repeal or eliminating the funds for the Patient Protection Affordability Act. Because as AHHE, George Steppenfeld will be convening periodic summits to keep us all abreast of this, because the act may not be perfect. However, the right to health care coverage applies to all of us.
The other thing is I think we'd like to have the panelists come up to the podium and give their presentation. So right now we're Dr. Moran from the Dominican Medical Association who wasn't able to join us. So we are joined instead by Dr. Leonardo Paula. Doctor, would you come up here, please?
Good night, everybody. Thank you for having us. A special thanks for Millie. He's always backing up. And Josh. Some of the concerns that have already been put up here are also the concern of the Dominican Medical Association, how to get Latinos affordable and quality care. And that's part of our concern too. And also, what's going to happen if the Republicans introduce changes on the reform that just the Congress passed that going to be impacting and it be a benefit of millions of Hispanic that doesn't have access to those care. And also the presence of more Latinos in executive position. For example, in our case, the Dominican Medical Association, even though we are called Dominican Medical Association, we also have people from other Latin American countries that join to us. Because probably in New York they don't have the representation, they don't have all the association. And we welcome all of them. And we facing different challenges. So, for example, we getting high quality doctors, nurses from other countries in Latin America that unfortunately they don't get the space here to be able to practice the different specialty that they gain in the country. And for us, it's a challenge. Sometimes they come already ready to get into residency program, for example, with all the board already passed, and there's no opportunities in different hospitals in this state or other state around United States. And it's a very concern because what we're seeing is, and we know that everybody would like to go to see a person that understands your culture, that understands your language. And what we're seeing, for example, in hospital in the Bronx, in Manhattan, I mean, a lot of physicians that we don't question the capability in terms of providing good care. But when it comes to the cultural sensitive, that's a problem. Because we're talking about they have to depend on translators to talk to our community, to translate symptoms, to translate complaints. And that's a problem. Because we don't feel that help in the process a good relationship between the patients and the providers. And so in those boroughs that I just mentioned, let's say the Bronx, where African American, Puerto Ricans, and Dominican constitute the vast majority of the population. So when you look into those hospitals, we are not really represented. And when we ask for opportunity for these young people that they are eagers to work with the community. I mean, what you find is in the high position they have to take the determination. Unfortunately, are people that don't speak Spanish. They doesn't understand the culture, and that's something that we have to put out there. And for us, it's pretty sad to see those people coming to us looking for help, looking for position, and unfortunately, some of them had to end up being a driver of a taxi or working in a restaurant. Unfortunately, all of them working even in factories. I don't think that that's fair, and think that that's something that also we had to discuss in this kind of forum. Because we're talking about accessibility to the community, but also to this professional that if they got the opportunity, they're going to do pretty good in terms of good relationship with the community. Thank you.
Our next speaker is going to be Dr. Lauro Medrano. Doctor is on the Board of Trustees of the Hispanic Dental Association and a pediatric dentist. Doctor?
Thank you, George. Thank you, George. Good evening, everybody. Unfortunately, Dr. Yolanda Bontas can't make it at the last minute, and he really regrets. But we're going to have everybody right here from the Hispanic Dental Association and trustee, as George said before, and we brought in the whole team of the New York chapter. I want to acknowledge our president, Dr. Esperanza Rodriguez. I also want to acknowledge Dr. Amaryllis Jacobo, board member, Dr. Yakira Tiaga, and Dr. Ruben Moronta. Thank you. This is a very important meeting for Hispanic Dental Association, HDA. That's the reason that we are here. And we brought the whole crew. Thank you very much. Okay. Hispanic Dental Association is based as a mission organization. It's of service, education, advocacy, and leadership toward optimizing the oral health care in all the Hispanic communities and different communities. We have three major points of discussion. I understand that the time is very limited right here, but I'm going to try to maximize those time. First of all, we want to encourage and continue to presence of opportunities for professional workforce careers. Also, we want to develop and disseminate actionable oral health care information. And HDA also want to create an open dialogue to build up partnership, develop, and guidance and policy. That's the reason that this meeting is such an important for HDA, because we want to build up the partnership. We are here to state that our association, that we are group nationwide, different ethnic groups, the mission of service, education, advocacy, and leadership. We're going to have some, Dr. Yolanda Bontas also wrote some important legislative talking points. As my dear friend Felix Ortiz was saying right here, the borders are mixed on oral health care law, which leave a very unfortunate message to the new Congress post-election. The voters did not list health care as a major determinant on how they're going to vote. Republican governors will inherit and govern 60% of the national population that lacks of health care. The access of care remains significantly changes for many Americans. According to the new release survey from CDC, 59.1 million of Americans were without insurance, in some part during the 12-month periods of this statement or this survey. This is a lot. This is up 400,000 from 2009. It's a very significant numbers. Half of those without insurance have in the middle class ranking, especially from 43,000 to 65,000. The reason that HDA want to be part of the AHHE is because dentistry is the largest small business in the country. 74% of the voters said that tax credit should still be provided to small business and also to offer coverage to the employees. I would like to thank you very much, and greetings from HDA. Thank you.
I'd like to ask Angie Millan, who's the newly elected president of the National Association of Hispanic Nurses.
Good evening, and thank you, George, for inviting us to be part of this roundtable. I wanted to start out and share NAN's mission to you first, and I want to let you know that the National Association of Hispanic Nurses are committed to the recruitment and retention of a nursing workforce that reflects the communities of our nation and the professional development in particular of the Hispanic nurse. We join our nursing colleagues in assuring quality health care for Hispanic residents, consumers, and promoting the enhanced access to educational, professional, and economic opportunities for all nurses, but particularly the Hispanic nurses. Non-membership is national, and we have 47 chapters throughout the United States, including Puerto Rico. As nursing professionals, we support the Affordable Care Act legislation that's directed toward the provision of insurance access coverage for the 32 million or more uninsured access for coverage. NAN, along with our national nursing colleagues, has the dedication, the drive, and the energy to assist with the upcoming changes in the healthcare system. Nursing has always been at the forefront in its commitment to client care with the focus of improved safety, care coordination, health promotion, and quality improvement. Proposed nursing opportunities in the Affordable Care Act directs efforts to ensure that nurses' expertise is a participant in the multidisciplinary team and healthcare reform. Increase opportunities for nurses in leadership roles and participation in advanced practice settings as nurse practitioners, nurse anesthetists, and clinical nurse specialists are key to facilitating a holistic approach to maximizing the health care of our communities. The Committee on the Robert Wood Johnson Foundation, the new initiative report that just came out on the future of nursing at the Institute of Medicine, provides key ideas for delivering health care to communities for healthier residents. It includes a future system that assures quality health care and it's accessible to the diverse population of the United States through promotion of healthy wellness and disease prevention. The belief that nurses have key roles to play as team members and leaders for reformed and better integrated patient-centered healthcare systems. So what are our recommendations? Our recommendations are that we want to assure a strong interdisciplinary team approach with nursing leadership as a team participant in the planning of all parts of the healthcare reform. We want to support and maximize nursing practice in accordance with respective professional training and education so nurses can work efficiently and appropriately as partners and leaders in healthcare teams. We need to support our nursing faculty education and advanced practice nursing training to maximize access to healthcare through nurse practitioners, advanced practice settings who focus on preventive care. And the point that I want to leave you with today is that it's critical that nursing plays an active leadership role in assisting with the upcoming changes in the healthcare reform system. Thank you very much.
We'll now have Luis Vasquez with the National Hispanic Chamber of Commerce on Health.
Muchas gracias por estar con nosotros aquí hoy, and I just want to go into English right now. Basically, thank you very much for being with us today, right? So I just want to thank you for being here. As I see this roundtable here today, I see the struggles that I see. And let's give George a great hand. George Seppenfeld, I think we have arriving. And my job is basically, when I got involved with George, and George asked me to be part of the, to try to chair the Chamber on Health, Hispanic Chamber on Health, is basically what do we do? And I think the opportunities that the hospital industry calls for, we are probably shortchanged when it comes to Latino doing business in the hospital industry and the health industry. And I thought that's one of the things that we're working on. And I think it's a struggle, and we speak about it at the board meetings and when we sit down. But I have great news to say. This is a roundtable, which is a success, and we're being televised nationally, and hopefully, in the internet. And one of the things that I really, I'm very proud of, and I'm very passionate of what I get involved in. You know, if you notice my wines, Casa de Vinos, I'm going to put a plug in there. Hopefully, you enjoy it this evening. But at the same time, I want to speak about a meeting that I had with Greater New York Hospitals. Mary Medina and Lee Perlman, and I know it's going to be a little late. I don't want to take your thunder. But a meeting that when you sit around a board meeting and you speak to the people who make decisions and individuals who are committed to our community, the last meeting is what I wanted to be able to talk about is able to get people who want to help us passionately and put the talk and walk. And that's basically what I think we had with Greater New York. And I want to give Mary Medina and Lee Perlman, which is the president of the Greater New York Hospital, a hand because as we said in the meeting, one of the things that we spoke clearly about is we need to support from corporate, from the associations, from hospitals, and we don't seem to be getting it. As a chairman of the National Hispanic Chamber on Health, one of my things and one of my goals is basically to try to get contracts for small minority Hispanic businesses and minority businesses. Very difficult because you have to be qualified, and you want to make sure we give the best when we're out there. And at a meeting with Lee Perlman, and we'll get, George is going to probably make an announcement a little later with Medina, Mary Medina, which is here with us, is basically when we sat down, we were able, they took us very serious in reference to what goals AHHE and the National Hispanic Chamber of Commerce has. We are starting very good initiatives, which will be forthcoming. We have quickly, they got on board with us. They said, what do you need us to help you with? And believe me, very few meetings we have where people can just speak and not follow the talk. And I'm very proud, and I think what you give Mary right now, let's give her a great hand, and Greater New York Hospital for doing that. I will not speak too much about the initiatives. They're starting to get, and we're going to probably solidify some of them, but I wanted to just mention, and reference to what my responsibilities are with the chamber is reference to try to see if we can get, as they mentioned here earlier, affordable health for small businesses. Because I have a small business, and I'm still looking for my health plan, which we're trying to develop a health plan with North Shore Hospitals, LIJ, and we're negotiating that little as we go along. But I think our commitment, as we all be here be here together, is how can you support AHHE and the chamber on health, and how can we all make sure that we ask, how can we help, and how can we advocate to make sure that these services, that the appointments, that the contracts, that everything gets to the Latino community and the minority community. So that's one of the responsibilities that I have, and I want to make sure that with the short time that we're here, that you understand that we are going to be getting to the next level with this organization. We do want to advocate on behalf of the Latino community, whether it's with the AHHE or with the chamber, and we need your help to make sure that you communicate with us and see how can we help to make sure that we get the message across. I want to thank you, and once again, Mary and Greater New York Hospital and all the sponsors and all those individuals who are working with us and all the presidents of the chambers. Muchas gracias, que Dios me la bendiga, and have a great conference.
All right, so now it really gives me a great honor to introduce our host, Ms. Charlotte Vack, who will be giving us some remarks.
Thank you so much. It's such a pleasure to be here. Probably should have started off at the beginning, but that's just fine. I want to welcome you all. Bienvenido a todos de parte de TIAA CREF. My name is Charlotte Bach Fernandez, for those who want to make sure there's a little Latina there. And I have the pleasure of leading the U.S. Hispanic Latino Initiative at TIAA CREF, where we have a great dedication to the Hispanic community, and I'm very, very proud of that. On behalf of TIAA CREF, I really want to tell you how pleased we are to welcome all of you into our headquarters building. We have a staff of probably 25 people who've been working on this for a number of weeks, most of it on their own time. So I just want to give them a little extra hand to all of them. And that's just a measure of our dedication to both AHHE as well as to the healthcare industry. So as a leading retirement plan provider for hospitals and other employers in the medical field, we support AHHE's efforts to bring Hispanic healthcare issues to the forefront of public discussion. And so we kind of noticed healthcare and retirement have something in common, which is significant, and they are both about a better future. Based on that, I want to tell you that we are very honored to play a role in advancing tonight's discussion, and we really look forward to seeing the important cause that we're discussing tonight move forward into the public eye. So in closing, I'd just like to say, AHHE, adelante.
Yes.
Thanks, Charlotte, very much. Next, we're going to present someone who you probably have seen either on C-SPAN or on CNN, but I'd like to invite Dr. Elena Rios, up to the podium to give a few words.
Thanks, George. It's an honor to be here. My name is Elena Rios. I'm president and CEO of the National Hispanic Medical Association and also our National Hispanic Health Foundation, which is affiliated with the NYU School of Public Service. And we're very happy to be affiliated with New York and part of this summit. I wanted to first acknowledge some of our board members that are here and our past chairman. We have a board member, Emilio Carrillo is here. And our past chairman of the board, Dr. Luis Esteves. I think, we were asked to put some comments together on the Affordable Care Plan. And let me just say, it was already mentioned, I think that 32 million Americans are going to be insured by this plan, by the health care reform bill. And out of all those people that will be helped by this bill, the Latino population stands to gain the most. So we have really a responsibility to talk to all our elected officials about the importance of pushing forward and advancing the healthcare reform over the next decade. Part of the issues that I wanted to bring up was, number one, the access to families. That it's not just access to individuals, even though there is an individual mandate that is being looked at and discussed, but it really is about our whole families being enrolled into insurance, whether it's public insurance or private insurance. And it's going to be up to our community health workers and our allied health professionals that are going to be part of the system of enrollment. And it's really going to be a new way of thinking about health, that we go out to communities and educate our people about the importance of insurance. Secondly, the second issue was the issue of quality. And quality care now means that there will be a whole new way of reimbursement to hospitals and doctors and nurses and dentists. And it's going to be based on outcomes and evidence-based health care and the quality of care that you provide based on these new definitions. The important thing to realize that part of quality is now cultural and linguistically appropriate services. Third thing was prevention, and that we should understand that the most important part of this whole plan or law is to change the resources in the country in health from a medical model to a prevention model, and to look at the social determinants of health in our communities. All the different federal agencies are starting to work together under a public health council under the leadership of the Surgeon General, Dr. Benjamin. And we're going to have transportation grants, housing grants, commerce grants, as well as HHS grants, but all kinds of funding from a multitude of sources, all leading to one thing, and that is how to make communities more healthy, how to have healthier lifestyles, how to have healthier nutrition. The Department of Labor giving more funding for the unemployed to have better jobs within the health system. So we're going to see this over the next decade. And then the last comment really was about the importance of workforce and the issues that was mentioned before by our nursing colleagues and our other medical associations here, that workforce is so important. We can't have 32 million more Americans insured enter into a healthcare system without having the workforce to provide the services, whether they're in clinics, community health centers, hospitals, community hospitals, academic hospitals, or at all levels of the spectrum of our workforce, not just the health professionals, which are the doctors and the nurses and the dentists, but all of the allied health workers, all the way down to the college students and new workers that we're going to need in healthcare. So let me just tell you just a few things about the National Hispanic Medical Association. We are a nonprofit 501c6. That means we are an advocacy organization in Washington, D.C. We advocate all the time for health care. We work with all of the groups here under another umbrella called the National Hispanic Health Professionals Leadership Network. We very much are interested in putting forward our leadership to advisory commissions, to grant review committees, and to positions within the federal government as well as state governments, and with corporate boards in corporate entities, because we do know how important it is that the Hispanic professionals that have experience from their own communities get to decision-making positions where they can make the decisions that would impact their communities. Just a few meetings that we've had just in the last couple of months. One with Secretary Sebelius. Secretary Sebelius runs the Department of Health and Human Services. The national Hispanic organizations were invited to meet with her in Washington. And that group heard from her a plea to help them, the HHS, as the various regulations get rolled out for this plan, to provide our input. And I want to tell you just a few things that right now that we need your input. One of them is the class standards. The culturally and linguistically appropriate standards are being redone, and you'll have until December 31st to put your input. Another one is health information technology, and the whole concept of getting more doctors and dentists and hospitals to get involved in health information technology. That's another area where they're pleading for us to help, working with the regional centers. Another area of CMS, interested in outreach to all our populations about the new CHIP and the new Medicaid and the new Medicare rules. And I could go on and on and on, but I want to just end with saying that I don't know even what to say here, but I think the leadership that's important from all our organizations and with George and AHHE here is so important. I think I'll just leave you with one story. We have a whole agency dealing with the delivery of care. And I met with a new office, an office of special populations. It's in the office of the director. And they told me that they've decided to have a cross-cutting office at HRSA to look at oral health, mental health, things that nobody's ever thought about. I mean, it's always been siloed, right? Oral health, mental health, and electronic communication through telephones and your iPads and all of that. These are the top agenda items right now at HRSA. And more importantly, the idea of the workforce. The Bureau of Health Professions, which is a bureau that heads up all of the doctors, the nurses, the dentists, and all the medical schools, is being led by a nurse. And I think it's so important to see the changes. The HRSA agency is being led by a nurse, Dr. Wakefield. So I think that the time has come where we see a lot of good changes, and we're on board to help, and we all need to work together to continue to fight for our communities to be part of health reform. Thank you.
Thank you, Elena. I'd like to now ask Dr. Sam Arce with the Spanish American Medical Dental Society of New York to come up here, please.
I'm going to give you a little bit of background information so I can make the points that I'd like to make. And I'm going to tell you that I'm going to advocate on behalf of the community that I serve and the people that I'm responsible for. In 1999, Congress mandated the Agency for Healthcare Research and Quality to prepare 2 annual reports. One is the National Healthcare Reform Research and Quality Report, and the other one is the National Healthcare Disparities Report. In 2003 came out the first report, and the first report suggested several things, and I'd like to highlight 3 things that it suggested. It suggested that disparities do exist in 2003. It suggested that there is inequality in quality, and that exists. Number 2 is that improvement is possible, not impossible. And number 3 is that disparities cost money. It costs money to taxpayers. It costs in terms of disabilities and loss of productivity and other things that happen. So that costs money. The fact that there are disparities has a cost implication. John Hopkins came out with a study that showed that 30.6% of medical costs are directly related to healthcare disparities. The latest report in 2009 showed no significant improvement or reduction in healthcare disparities. That should be shocking to us, but that's the reality of life. And that was based on data on use of services, access to healthcare, and the impressions of quality that patients have on the services they receive. The results are the following. Hispanics have worse access than non-Hispanic whites for 83% of core measures. We had 70% worse treatment and only 20% better treatment in some of the core measures. Minorities are more likely to be diagnosed with end-stage breast and colon cancer. Hispanics are less likely to receive optimal care from MIs. And a study in the New England Journal of Medicine suggested that minorities are less likely to be referred for procedures such as cardiac cath procedures for the same symptoms and the same complaints as whites. Minorities have increased HIV deaths. Minorities have increased new cases of AIDS diagnosed. 17% of the elderly Hispanics do get fair or poor care. Now, I talked to a group the other day, and they said, oh, in my facility, they get great care. Don't attack me. I'm talking about across the country. I'm not talking about your facility. Your facility must be the best. 30% of Hispanics lack a usual source of health care, and that's compared with 16% in whites. And 2% of Hispanic children admitted with asthma to a hospital did not get routine, only 2% got routine prescriptions for asthma care. 34% of Hispanics, no insurance. Identifying that disparities exist is important, but it is not enough. Now, why is this happening? One, people have already spoken that there's a lack of insurance. If you need my watch doesn't work. Hispanics get more illnesses, they say. Hispanics get more complications because of late diagnosis.
Right.
And there's a language and cultural barrier. And there may be some bad physician-patient relationships. Despite improvement in quality on specific measures, disparities still exist. Healthcare disparities are not getting any better. So here are our recommendations, and I'm on the end now. Reduce the uninsured. I think healthcare reform is going to help with that, as long as some colleagues over there don't turn back the clock and destroy what has been accomplished up to now. This is not a political announcement. Expand access to all ethnic and racial groups. Educate and prevent disease. And that means educating. What I mean by that is to raise the skill level in all levels among the Hispanic community, both on the supply and demand phase of it. Form partnerships with private and public sectors to involve all of healthcare representatives, and promote and continue to promote funding for centers of excellence, because they provide good health for our communities. And obviously, we need to partner with some of the faith group organizations that are around. Increase the minimum standards for culturally and linguistically competent health services with use of interpreters. Your facilities should have interpreters. In New York, we don't have that problem, but if you go outside of New York, you'd be surprised. Clear communication is so important. Improve the training for clinicians to improve workings with minority groups. Increase workforce. It's mentioned already. I don't need to go into that, but it's amazing. By 2050, almost 50% of the population will be minorities, and about 25 to 27% will be Hispanics. There are only 3.8% Hispanic physicians in the whole country. There are 2.4% dentists. There are 3% nurses in Hispanics. Big discrepancies. There must be something wrong with there's no diversity there. We need a strong national strategy to promote diversity. We need to increase the pipeline. We need to promote mentoring and shadowing programs. And one of the organizations that I wear a hat for, which is the Spanish American Medical Dental Society of New York, we're starting a shadowing program to get youth, hopefully Hispanic youth, to get involved in the field of medicine and to want to be there. And we need to create leaders. Elena mentioned that, and at the National Hispanic Medical Association, which I am part of, that's one of the things we're doing. I'm part of a fellowship program this year, and it's to create leadership so that we can be counted, we can sit at the table. Create incentives so that physicians can serve in underserved communities. And the last thing is, we need, and I'll just mention it because people hate it when I bring it up, but I need to bring it up for my colleagues. We need to reform the malpractice situation and bring about some tort reform, because that's going to allow physicians that may not serve in an underprivileged area to go and serve because they won't have to worry about their malpractice. It is possible, I'll end by saying it is possible to end disparities, not just reduce them. Thank you.
Thank you, Sam. Okay, well, the last person on the panel is probably the one that's traveled the furthest distance to visit us. And what you don't know about him, because we didn't note it, but he's an MD, PhD candidate from California. So he's the national coordinator for the Latino Medical Student Association. We've never had a student association here, so I'm really happy and quite proud that he's taken his time and his dollar to come out here. So without further ado, may I ask Alvaro Glavis to come up here.
Thank you very much, George. Let me just begin by saying 2 sentences about the Latino Medical Student Association. Our mission is to increase the diversity in medical schools and to advocate for the Latino community. One of the big statistics that really is hard to us and it's hard to deal with is that by the year 2025, there'll be 121,000 physicians shortage nationwide. Wow. Unfortunately, all communities will not be affected equally. And in fact, the Latino community is one that is most likely to be affected the most. Why? First, 55% of all successful medical school applicants come from the 5 percentile tier of family income. That is to say, they're coming from a family income of average of $90,000 a year, which most Latinos do not. Second, the average medical student debt right now is $155,000 a year, wow, which has put on pressure in the medical profession to push for specialty training. There's no longer going to be enough primary care physicians to meet the demands the Latino community will need. Third, there's been a stagnant number of Latino medical students applying to residency programs, and a stagnant number of Latinos getting into medical schools. The numbers are just not there. They're not applying. They're avoiding their profession. Why? Well, that's why we have these recommendations. One is a pipeline program. And we're not talking about just a pipeline program from high school into 4-year institutions. In fact, right now, more Latinos are graduating a 4-year degree than ever before. The problem is we are not creating good medical school applicants. There is a lack of mentorship. There's a lack of the tools that the Latinos need in order to apply into medical school. There's a huge discrepancy. And there's models that are available out there that are actually starting to begin to change this trend. One, you could look at the University of Illinois, Chicago. There's the Hispanic Centers of Excellence that actually paid by the state. It is a line item, budget item that sponsors about 145 pre-medical students to try to apply for medical school. And in fact, they're one of the high, and then when you look at their numbers for medical school, their number is one of the highest of Latinos. They have about 25% of all the medical students are Latinos. So there is success stories there. California is another one. You're looking at Biological Scholars Program, which is sponsored by the University of California, and they are cranking out enough students that are applying to medical school. However, when we get there, we have another problem. Medical schools lack the curriculum to train physicians to deal with the Latino healthcare needs. There's a lack of medical Spanish training, culturally competency, or any background, this discrepancy will get greater and greater if the numbers remain stagnant. There's also a model for that, the PRIME-LC program, which stands for Program in Medical Education for the Latino Community, which is sponsored by the state of California, pays for 45 medical students to get a 5-year degree, which includes an MD and an MPH or an MBA, to create leadership training and advocacy for the Latino community. And we're looking down the line, maybe 15 years from now, these are the leaders for the Hispanic community in California, and they will lead the way to help change this healthcare needs in that area. Fortunately, there's not that many other programs nationwide. We need the state to actually institutionalize and support programs in medical schools. My third point is we need research. There's not enough research about the Latino community and their healthcare needs. That, in fact, will then translate to lack of students, lack of leaders in MPH programs. We're not now talking about physicians. We're talking about doctoral students. We're talking about MPH. If the dollars are not there, if there's a lack of research, we don't know. We're not able to meet those demands, whether it be California, Illinois, New York, and so forth. We need dollars for that type of research. And fourth, I would like to advocate for organizations just like LMSA who take the time to create conferences, student panels, mentorship. We need money to help these organizations continue to do what they do best, which is to prepare pre-medical and medical students into their next step of their healthcare career. Thank you very much.
Well, we're running out of time, but I just want to talk to you about an issue that is really a mental health issue that is really affecting our community. And I'm going to ask you all to be very vigilant and really proactive. And it's the case of young Latinas and suicide. In the state, is currently 15% Latinas are trying to attempt suicide. And, this is a problem. I testified in Albany 2 weeks ago. I have spoken to Assemblyman Ortiz, who's the chair, and also Peter Rivera. And I spoke to the Commissioner of Mental Health. And this is an issue that it definitely needs to be addressed. What will happen to our community if our young Latina girls are trying to commit suicide? And so this is an issue in mental health that I will say that I will be going crazy about, and I am asking you to do the same, because we cannot have our young adolescents committing suicide. So we're going to be sending emails and asking you to be involved with Action Alert, and also we're going to be having a mission to City Hall in Albany, and so we will be reaching out to you. Thank you.
Okay, what I'd like to do now is just open up the floor to a few questions of our panelists for about 10 minutes. So we have some mics at either side of the room. Now, I'm going to ask that you make your questions short because the 1 minute is going to be a half a minute. So please make it short, and if you want to direct it to the panel in particular or just to one. Good, Doctor.
From the medical director of Bethesda Latino Health Institute and New Jersey Latino Health Institute. In regards to the workforce, I'd like to know what the panelists feel about the simple fact that postgraduate medical education in the United States for doctors is paid by Medicare. It's paid by the federal government, not the hospitals. But yet, being a faculty member in 2 medical schools here in New York since 1995, people don't realize that in 1996 there was a federal mandate through Medicare that any hospital that had over a certain percentage of doctors graduated from medical schools outside of the United States, even if they were U.S. citizens, they will have their reimbursement cuts in regards to the payments. That is the major problem with workforce issues, besides the decreased entrance of medical students into from the Latino origins. What is your experience in this, and what is being done to correct this?
From my experience, it was COGME, the Council on Graduate Medical Education, which is an advisory committee housed at HRSA that made that recommendation. So that's where we get, so the effort then is to go back to COGME and reverse it, to go to our elected officials and whatever we can do to help. We have a report that's about to come out on a committee that we pulled together last year on increasing diversity for Title VII, which is medicine, dentistry, and public health. It's not nursing because they have Title VIII. But we brought together Black and Hispanic leaders from medical education to make recommendations, and be happy to talk to you more about that, how we can include that in those recommendations.
Roy?
Yes, thank you. Henry Calderon, East Harlem Chamber. I wanted to comment on Dr. Hass's remark about tort reform. I think it's critical to delivery of medical care and delivery of preventive care. And I'm wondering what initiatives the organizations here have in focusing with the legislators who control this as to understand how we need tort reform. Just as important as preventive care and any other part of care, we need to have tort reform. I'm wondering what we have to get to that point.
Sam?
I was just fortunate to be recently at the White House for some healthcare reform meeting, and there were some high officials there, and I was trying to be very polite because I knew where I was and I wanted to be invited again. But they opened up the door. A very high position person opened up the door and allowed me to walk in. So I took advantage, and I said, you know, you're asking me to go back and tell my colleagues how we need to implement, but you're asking us to see, so I need your help. I told them, I need your help to suggest to me what to do. And I'll tell you this to tell me so I can tell you what the answer was. We're going to have to see more people in less time for less money. We didn't fuss about that, but you didn't do anything about healthcare reform, tort reform. And the answer that I got back was not the answer that I wanted to hear. The answer that I got back is that we did not want to take on a second battle at this time. So hopefully that means that there is, at some point, some hope for that. But I was told point blank that this is not the time to even bring that up. And we were still vocal about it because obviously in our field we feel that is important. Our pockets may not be as deep as other pockets are, and perhaps that has to do with it. That's a side issue. Maybe Elena would
follow up.
Add to that.
Tort reform is not national; it's a state issue, and I would recommend that this organization have a committee on tort reform, so the legislators understand that we're serious about this. Because I think a lot of people want to do it, and because of political considerations, it doesn't happen. If we don't push it, no one else will. Not the national level.
At
the
New York
local
State,
level, the state level.
At New York State, I'm involved with MISNY also. And in the last 2 years, we've done something that hasn't happened before. For instance, 2 years ago, we took almost 2,000 physicians to Albany. That has never, ever happened before. I don't know who is here that went to med school, but when I went to med school, there was no course on becoming united and becoming business-oriented and standing together as a group. So we're not with that mentality, and we probably should. But we took a group up there, and this year again, it was a large group, enough to fill a huge auditorium. Unfortunately, there are some legislators in New York State that have specifically stated, quote unquote, over my dead body. So I don't know if we have to wait for life insurance to kick in there, or but I certainly we're trying to do something about it, to answer the question. And
Roy Postman from Outpost Communications. I also have a little bit of a historical perspective on all of these issues that we're talking about today, having been in the business of doing healthcare communications for the last 15 years now. First of all, I want to congratulate the Roundtable for formalizing yourselves as a Roundtable. I feel like I have an integrated healthcare team working for the health of the Latino community, which is great. So when we started working in the area of healthcare, one of the studies and reports and recommendations that I used to look at was Healthy Communities 2010. And we're in 2010, and I haven't heard a peep about that report, but one of the recommendations of that report was around communications and the need for education. And I know we still hear that over and over and over again about the Latino community and the need to inform and educate our Latino community about health issues, about health resources, and other like things. So I was just wondering from the panel, and Dr. Rios, you mentioned the clear communications, and I was happy to hear about that. But what recommendations or issues, projects you think the roundtable could work on around the issue of communications? If anybody could comment on that.
Well, just let me make that comment. As I said, when we had our 5 to 6 p.m. meeting, we decided that we were going to take some very proactive action. So that can certainly be one of the items that we can put on our agenda. We're going to look at how we can better communicate, not only amongst ourselves, but also on some of those issues, on initiatives that really we haven't seen a net result from. So we're going to be working on that. I want to just, that was Roy Cosme. Roy is president of Arcos Communications, one of our in-kind supporters. I want to thank Roy with Arcos. I want to thank Casa de Vinos, Market Vision, Salsa Caterers, and TIA Cref for their support in kind of services, and thank you very much. So I want to recognize that. Do we have one more question or two more questions, and then I'm going to kind of wrap it up with a summary and then a special announcement from a representative from Greater New York. Yes.
Buenas noches todo, yo hablo bien español. I just wanted to let you know that I'm with Pharma Consulting. We do clinical trials in Mexico as well as in the United States. So I am both, my feet are in both worlds, and I totally appreciate where you guys are coming from. I just wanted to make you all aware, we are having a forum in February. I talked to George about it. Dr. Rios and Angie Milan are also going to be there. But I wanted to bring up this issue that hasn't been brought up at all. I think maybe you brought up a little bit, Carmen, and that is that the data shows that there are only 3% of all clinical trials in the U.S. have Hispanics and Latinos. I know we know this, but it's maybe not everybody knows that. And yet 16% of the population is Hispanic and Latinos. And I think it's time that we bring together private industry, which is I work with a patient recruitment company, people like Pfizer, which we're very happy to have you here, and really start looking at how we can bring together those best practices. What are the system barriers and the patient barriers? So I would just love to hear your comments because it really wasn't brought up very much at this roundtable. And thank you again. Buenas noches.
Okay, we have one question. I'm going to take the gentleman in the rear first. Yes, sir.
Actually, I don't have a question, just a brief statement. My name is Yakir Arteaga, and I'm a dentist. I'm actually the vice president of the New York chapter of the Hispanic Dental Association. And I just want to say that if we're behind in medicine, we're way behind in dentistry. And in dentistry, we're not only dealing with the issue of lack of care or lack of access, but we're also dealing with a cultural issue in the Hispanic community. You know, many of Latinos don't see oral health as critical or as necessary. And, you know, if we look at the literature today, we're finding more and more links between poor oral hygiene and diabetes, cardiovascular disease, or low birth weight babies. So I just want to make everybody aware that, you know, we're very happy to be here. Oral health is very important, and it needs to be part of the entire, you know, initiative. So thank you. That I'm very happy I made it today. I was feeling a little bit under the weather, so I almost didn't come. But I'm very happy that I was able to attend.
I think there's a doctor in the house. Thank you. Yes, sir.
Yes, it's been an informative evening. My name is Joseph Selman. I chair the HIV/AIDS committee at the National Action Network. I want to thank Dr. Arce because I think he alluded to HIV and he's been the only one on this panel. I guess my comment, I'd like to urge this association to be more proactive because that it exists in the Latino community, the Black African American community. I'm an advocate. I'm living with HIV for 24 years, and I'm retired, and that's my job now. So it's been very informative. I was glad I could make it here tonight.
Great. Thank you very much, sir. So I'd like to have Miriam Zavala kind of give us a little wrap-up in about 3 or 4 minutes. Miriam?
Thank you for having me, and thank you for coming. The common threads that I have heard from the panelists are that the importance of maintaining Patient Protection Affordability Care Act, not just for medical services, but oral services and mental health, and that there is health disparities as cited by the different data that has been stated by the panelists. There is inequalities, and the importance of having these type of gatherings, summits, in order to keep us together, in order to maintain the Patient Protection Affordability Act, as Sam Arce, I've been quoting him. There's strength in numbers, right, Sam? Okay.
That's right.
Yeah. That's it.
Before we kind of branch out for those that are going to be attending the VIP reception, I just want you to also, if you, as you go out, please take the opportunity of meeting with our event exhibitors that are outside. They're the ones that help make this possible, including our national and regional partners. So without them, it's really difficult to have these forums, even in the best of times. Now, we're going to have a little special announcement. I spoke earlier about some of the initiatives and the collaborations with Greater New York Hospital Association, but now I want to give an opportunity to Mary Medina with the association to talk about a very special gift that we're receiving from them. Mary.
Good evening. It's a pleasure to be here with all of you. And I usually don't need a mic, so I'm going to turn it away. I am very, very impressed to be in the presence of such dedicated professionals who have been at the forefront of all of these issues for many, many years. Some of you I know for a very long time. Others of you I've just met tonight. And I will tell you that there is no more staunch advocate on your side than George. He will make sure that we, at the Greater New York Hospital Association, and all of our members work diligently to address these issues with you. So the key word here is with you. I have the pleasure of heading up the diversity initiatives that are focused on trustee recruitment. So it is very important for you to understand that these decisions are made on the governing boards of hospitals. And we are fortunate to have 2 trustees here with us tonight. One happens to be Henry Calderon, and the other is Rita Martino, who I saw earlier. And it is with their leadership and the other diverse board of directors that these issues get brought to the table. In addition to that, workforce issues has been a particular interest for Greater New York Hospital Association. And my colleague, Lloyd Bishop, who's the vice president at Greater New York, addresses cultural competency, healthcare leadership executive training, as well as the summer enrichment program, in which we focus on undergraduates and graduate students. And as the director of the summer enrichment program, I will tell you that I will need you to ensure that there are Latina applicants applying to this 12-week program. It is an incredible program for them to not only shadow, but have access to the executive leadership of the hospital membership in New York and New Jersey. With that said, we are committing the Greater New York Hospital Association leadership team. Now, my team didn't know this, but they are committed to work with us on assuring that the middle managers and your managers council, I don't know if you have representatives here, I certainly would hope so. The managers council, I will be working very closely with the managers council to ensure that they have access to the executive C-suite of our hospital membership. And we are committing to support not only through in-kind, but an actual $25,000 contribution for the development of this program that's focused on executive leadership. So.
I was not trying to kill the surprise earlier, but this is what we were going to. Yeah, and I also want to mention that we did have a thanks to Mary Medina Lee Perlman at Greater New York Hospitals, we're able to get a meeting with GE. So I got two representatives, Alfredo, and someone else is here from GE, the corporation, so they can stand up. GE Healthcare. Thank you very much for being with us. And that's something that we're trying to get the initiatives going with the National Health and AHHE. So I want to, one more time, thank you very much for the confidence in us. And this is what I was trying to say earlier. They put the mouth where the talk is, and that's in the walking, whatever you want to call it. After I have my wine, I'll definitely clear that out. It's a wine, but hopefully we're going to enjoy that. But thank you very much. Thank you very much. We appreciate it.
I also want to acknowledge the AHHE board members that are here tonight. Now, I know I saw Christopher Rodriguez back there, Millie Onofrietti, Jeanette Marrero is around someplace. Who's I missing? Nilda Soto, our vice president, is back there hiding. She helped me do some distribution of materials earlier. And I have Miriam here, obviously. So anybody miss? No, okay. And I have my co-chairs of our managers council. So I want to thank you for your support. And I know that Carmen wanted to acknowledge some of her board members also.
Thank you. I just want to make sure that I acknowledge our current board member, Rosa Brambrowitz, is with us, and also our past president, Suzanne Colin, and some board JBFCS colleague, Rebecca, and my other colleague here. Thank you.
And again, I just want to thank everybody for coming. I want to certainly thank TIAA-CREF for their support, their work over, whenever you put these events on, they're extremely stressful. And I'm glad that we were able to work together to make it happen. You know what? These kind of events are partnership developing. It's not a one-time event. It's how you develop the partnership. And we're trying to develop that partnership. So we thank you for being here. Now, here's the difficult part. Those that did not pay for their reception have to enter or exit through the front door here. Those that are attending the reception will enter through the rear door, and your passes, credentials will be verified. Thank you again. Hope to see you real soon.